Welcome to this informative video on labyrinthine concussion. This often overlooked condition can significantly impact your balance and vision, affecting your daily life. We'll delve into the causes, symptoms, diagnosis, and management of this disorder, providing you with a comprehensive understanding. Labyrinthine concussion, at its core, is a type of inner ear injury usually triggered by a head trauma. This trauma can range from a direct blow to the head, as seen in sports injuries or falls, to whiplash injuries commonly occurring in car accidents. The sudden acceleration and deceleration forces involved disrupt the delicate structures within the inner ear, leading to the concussion. Less frequently, barotrauma, which involves significant and rapid pressure changes like those experienced during scuba diving or air travel, can also result in labyrinthine concussion. The inner ear houses the labyrinth, a complex system crucial for both hearing and balance. Within the labyrinth are the semicircular canals, which detect rotational movements, and the otolith organs, sensing linear acceleration and gravity. A concussion disrupts the delicate fluid balance and can damage the sensory cells within these structures. This disruption leads to conflicting signals being sent to the brain about the body's position in space, causing dizziness, vertigo, and imbalance. Furthermore, the inflammation and potential hemorrhages within the inner ear can further exacerbate the symptoms, impacting visual stability as the brain struggles to process the distorted spatial information. While precise epidemiological data is limited, labyrinthine concussion is considered a relatively common consequence of head trauma. Its true prevalence is likely underestimated due to the fact that the symptoms can sometimes be subtle or attributed to other conditions, like general concussion or whiplash. Individuals involved in contact sports, those who have experienced motor vehicle accidents, and older adults prone to falls are at a higher risk. It's important to note that even seemingly minor head injuries can, in some cases, lead to labyrinthine concussion. The signs and symptoms of labyrinthine concussion can vary significantly from person to person, but some are more common than others. The hallmark symptom is vertigo, a sensation of spinning or whirling. This vertigo can be episodic or continuous, and its intensity can fluctuate. Dizziness, lightheadedness, and imbalance are also frequently reported. Vision can be affected, with symptoms like blurred vision, difficulty focusing, and nystagmus, an involuntary rhythmic eye movement. Some individuals may experience nausea, vomiting, tinnitus and ringing in the ears, and a feeling of fullness or pressure in the ear. These symptoms can be debilitating and significantly impact daily activities. Diagnosing labyrinthine concussion involves a thorough medical history, a physical examination, and specific diagnostic tests. The doctor will inquire about the mechanism of injury, the onset of symptoms, and any pre-existing medical conditions. The physical examination typically includes a neurological assessment and an evaluation of balance and coordination. Specialized tests, such as electronystegmography (ENJ) or videonystegmography (ENJ), are used to assess eye movements and vestibular function. Audiometry, a hearing test, may be performed to rule out other inner ear disorders. Vestibular evoked myogenic potentials (VMPs) can also be used to assess the function of specific inner ear structures. Magnetic resonance imaging (MRI) might be ordered to rule out other causes, such as a tumor or structural brain damage, particularly if symptoms are atypical or persistent. While there isn't a formal classification system for labyrinthine concussion like there is for some neurological conditions, it's often described based on the severity and duration of symptoms. Some clinicians might categorize it as mild, moderate, or severe based on the impact on daily activities and the extent of vestibular dysfunction. The acute phase typically refers to the initial days or weeks following the injury, while the chronic phase describes symptoms that persist for months or even years. However, it's important to recognize that each individual's experience is unique, and the terminology used can vary. The treatment and management of labyrinthine concussion typically involve a multi-faceted approach focused on symptom relief and vestibular rehabilitation. In the acute phase, medications like antiemetics and antihistamines can help manage nausea and vertigo. Vestibular rehabilitation therapy (VRT) is a cornerstone of treatment, involving exercises designed to retrain the brain to compensate for the inner ear dysfunction. These exercises may include gaze stabilization, balance training, and habituation exercises. Canalith repositioning maneuvers, such as the Epley maneuver, may be used if benign paroxysmal positional vertigo (BPV) is present as a result of the concussion. Psychological support such as cognitive behavioral therapy (CBT) may be beneficial for individuals experiencing anxiety or depression related to their symptoms. In rare cases, surgery may be considered if other treatments are ineffective and there is a clear anatomical abnormality. Preventing labyrinthine concussion primarily involves reducing the risk of head injuries. This includes wearing appropriate protective gear during sports and recreational activities, such as helmets and mouthguards. Ensuring safety in the workplace by following safety protocols and using appropriate equipment is also crucial. Taking precautions to prevent falls, especially among older adults, is essential. This can include addressing hazards in the home, such as loose rugs and inadequate lighting, and using assistive devices like canes or walkers when needed. Safe driving practices, such as wearing seatbelts and avoiding distracted driving, can also help prevent head injuries from motor vehicle accidents. The prognosis for labyrinthine concussion varies depending on the severity of the injury and the individual's response to treatment. Many individuals experience significant improvement in their symptoms with vestibular rehabilitation therapy and other supportive measures. However, some individuals may experience persistent symptoms, such as chronic dizziness or imbalance, that can significantly impact their quality of life. Recent research is focusing on identifying biomarkers that can predict prognosis and on developing more targeted therapies for vestibular dysfunction. Studies are also exploring the potential role of neuromodulation techniques, such as transcranial magnetic stimulation (ATMS), in improving vestibular function. Continued research efforts are essential to further enhance our understanding and treatment of labyrinthine concussion.